Hello, and welcome to this short little video on patient assessment and patient care. Here's where we're going to learn the importance of listening and writing down things our patients say. The first part of patient assessment is patient identification. We identify our patients by their name, their date of birth, and by checking their wristband. So always ask name, date of birth, and don't forget to look at the wristband just to make sure you do have the right patient. There is a huge importance of effective communication with your patients. The importance of effective communication is huge. You always need to ask your patient open-ended questions. You need to listen to what the patient is telling you, and then repeat back to the patient what they have said. This way they know you heard them. It's important to gain your patient's cooperation. So one of the first things you're going to be doing with them is explaining the procedure to them thoroughly, in a way they can understand. You also need to be reassuring to the patient without being condescending, and warn them before you touch them. Another big part of communicating effectively with your patient is taking their clinical history. So here is where listening really comes into play. You need to be objective. It's their words, not yours. Patient states. Be very thorough with your clinical histories. One of the biggest parts in medical imaging and getting that clinical history is the prior records. They are so important, making sure that the prior imaging exams are in the building before you go and do that second follow-up mammogram. That is so huge to have those there, so be very mindful of that. And now we've come to the elephant in the room, and that's HIPAA, Patient Confidentiality. HIPAA stands for the Health Information and Portability and Accountability Act of 1996. Just remember, it is the law. Big changes have happened since 1996 because of HIPAA. Number one is that patient records are not accessed for anything other than medical reasons. No personal curiosity there, okay? Patients are never discussed, ever. Now, new social policies are also in effect at specific institutions. Actually, not just specific, but probably at most institutions. With cell phone cameras and tablets and Facebook, patient information, it tends to fly out the door and into those places, and that's not supposed to happen. So review the social media policies at your institution. I want to thank you for joining me. I told you this would be very short and sweet. You've heard all of this stuff before. This is nothing new to you. It should not be a shock. So just keep it all in mind, keep it fresh and up front in your head, and we'll